Let's briefly go over the typical, I'm going to emphasize that, the typical treatment that you'll see in an injury case. And I'm going to assume just off the bat, and this is typical, this is the most common, this may not apply to you, but this is the most typical, so I'm just going to assume that this is either a car crash, a premises case, or let's say a dog bite, or some other injury where you are on someone else's property. That's what we're typically talking about. Let me knock out the dog bites right off the bat. Typically what you're seeing a dog bite, it's really kind of crazy. Most of the time whenever the client comes to us, all they've gone to is the ER, no one else. We always recommend that they follow up with a primary care physician. You're going to see a primary care physician in the majority of injury cases. Also, something else that you're going to look at is we'll typically send our clients to a plastic surgeon to find out what the cost would be for a revision surgery. So that's the typical treatment that you're going to see, and many times after that, you may see the client get the surgery or not. It really depends on the client, but you're going to see the emergency room or urgent care. Usually it's the emergency room for dog bites. You're going to see primary care physician, and then you're going to see a follow-up with a plastic surgeon just to get an idea as to what it's going to cost, what the surgery is going to look like, even if you need surgery, whether they think that you're going to heal up. And it really depends on your age too. There's a lot of factors that go into it. Now let's talk about car crashes, and let's talk about premises liability cases like a fall. We're not going to touch malpractice, products liability. There is no typical way of handling those injuries because they're all different. So we're not going to cover those. We're going to wrap up here with car crashes, premises liabilities, because usually the treatment is fairly similar. Typically what you're going to see is your urgent care or an emergency room. It depends on the person, or you're going to see a primary care physician. Like I said, it depends on the person because by the time they've called us, they've already gotten that initial treatment, but that's usually what you're going to see. After that, it can vary as well, but you're going to see typically one of three things: primary care physician, physical therapy, or you're going to see a chiropractor. Regardless of who you choose among those three, you're also going to see imaging. What I mean by that is x-rays, and those are the least valuable information unless you have a fracture or a break. You don't get a whole lot of information other than that. You're going to see some CTs, those are CAT scans. Those can be fairly valuable. They're valuable when it comes to brain injuries sometimes. They don't give you all the information you need for brain injuries, but they can be valuable sometimes. And then the most valuable imaging generally is going to be an MRI. Like many things, MRIs, there's different quality of MRIs. Some of the MRI machines are fairly junky, and if the doctor needs more, they may send you out to a different imaging facility. If, let's say you did go to the emergency room and you got an MRI and it was a sort of a junky MRI machine, which is not typical of ERs. It's also not typical of ERs for them to do imaging with an MRI because they are so expensive at the hospital, but you do sometimes see them. But if it's a junky MRI machine, then they may refer you out to someone else. Something else you're going to see is pain management. Pain management is where they're dealing with the pain. Many times that means injections. So injections in the spine, injections into wherever the injury may be, and that's to help relieve the pain, and that is a pretty effective technique. I'd say 10 years ago, not great. I'd say the results not great. The techniques have gotten better, the medications have gotten better over the last decade. You're going to see that, you're going to see better results these days. If that doesn't work, that doesn't help, then you're going to see an orthopedist, and the orthopedist is going to help you determine whether or not you need a surgical intervention. That's if the imaging supports it. If you're showing some protrusions, some herniations, and whether or not this is going to be something that resolves on its own. So they're going to be able to give you that guidance, and then after that, you're going to see surgery if you need surgery. And the bills that you might see, an imaging or a surgery center or a hospital, depending on the orthopedist, they're going to determine where their privileges are and where you're going to have that surgery. And then you may have some follow-up physical therapy. Many of the surgeries these days don't require physical therapy that they used to a decade ago. It's quite interesting. The surgeries are getting far better than what they used to. They're less painful than what they used to be. You're seeing a lot less physical therapy that's required. This is the typical injury case, the treatment that you might need. Other types of cases are going to require different types of treatment. Just know that I'm going over the typical stuff. Let's say you have a leg injury. I didn't cover all that. I'm just talking about the typical types of injuries because usually you're seeing a lot of spine injuries and head injuries for a car crash and premises liability case. And with that, last note I will say, because I left this one out, sometimes you will see a neurologist. Neurologists are hard to get into, and they typically can't do a whole lot for you. And that's why you don't see that a whole lot, but sometimes they are able to. And for very serious traumatic injuries, mild TBIs and severe TBIs, so traumatic brain injuries, then you're going to see a neurologist as well. All right, that's all I have for you. If you have any questions, as always, give us a call, shoot us a text, or shoot us an email, whatever is easiest for you. All right, have a great day. See you, everybody.